My name is Kathryn Coleman. Today is August 29th, 2024. This is my head-to-toe assessment for fall of 2024. This is my patient and my supplies. This is around the room. Alright. Alright. And then there's the floor and the ceiling. Okay. Alright, so I will start my assessment by assessing the skin. We'll be checking for the color, the temperature, moisture, the texture. I'm looking for edema, checking skin turgor, looking for bruises, any scars or lesions. Going to be looking at the head, face, the neck, posterior and anterior chest, and the abdomen. So there's no abnormalities noted. Temperature is warm, color is appropriate for ethnicity. So now I'm going to inspect the head. I'm looking at size and symmetry, midline position, normocephalic. I'm going to be palpating. I'm feeling for any abnormalities. There's none noted. Looking at the hair distribution, the color, it's brown. Didn't notice any masses, any lesions or any abnormalities, and there's no infestations. I'm gonna palpate the temporal arteries for tenderness. Okay. Then we'll palpate the lymph nodes of the head and neck, preauricular, postauricular, the occipital on the back of the head, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and the supraclavicular. So next I'm going to check for TMJ. Alright, open and close your mouth. Okay, side to side. Okay. No subluxation or tenderness or crepitus. Next I'm going to assess cranial nerve 5. So the trigeminal nerve. That's going to be the motor and sensory. So I need you to clench your jaws. Okay. Cranial nerve 5, the motor cranial nerve 5 is intact. For sensory, need to close your eyes, tell me where I'm touching.
Forehead, nose, cheek.
Okay. Cranial nerve, the sensory of 5 is intact. Now, I'll do cranial nerve 7. Looking at facial symmetry, I need you to smile for me. Frown. Butt puff your cheeks. This is the facial nerve. Frown for me, raise your eyebrows. Okay. And cranial nerve 7 is intact. So now I'm going to inspect his ears. Looking at the shape, position, they are symmetric and even. I'm going to be palpating the pinnae and the tragus. I'm feeling for any masses, tenderness, none of that. Now I'm going to inspect the auditory canal and the tympanic membrane on both sides. Okay. Tympanic membrane is translucent, pearly gray, and the auditory canal both sides are clear bilaterally. Now I'm going to assess cranial nerve 8, which is the vestibular cochlear. So I'm gonna assess the hearing. I want you to cover your ear over there. All right. You gotta say what I'm saying. I'm gonna whisper.
1, 2, 3.
Now do the other side.
1, 2, 3.
All right. So now do the Weber test for lateralization. So tell me if it's equal or more on one side or the other.
Equal.
Okay. Now I'm going to do the Ryan test. All right.
I hear it.
Just tell me when you can't hear it, which for the sake of time. Air conduction is greater than bone conduction. So now I'm going to inspect the eyes. I'm looking at lashes. They are symmetric, looking for any kind of issues, palpable fissures or anything. All normal. Looking at the sclera and the conjunctiva. The sclera is white and conjunctiva is pink. No lesions, no discharge or anything like that noted. Now I'm going to assess cranial nerve 2, which is the optic nerve. So I'll have to read the chart. I would be 6 feet away, but I can't for this. So cover your left eye, read the lowest you can.
D, E, F.
Alright, now do the other one.
F, E, D.
Okay, both eyes. Okay. patient is 20/20 bilateral. So now I want to check the peripheral vision. So cover up that over there. All right, can you tell me how many fingers I got?
2. 2.
Okay. That is cranial nerve 2, and it is intact. So I'm going to assess cranial nerve 3, oculomotor. I'll look straight ahead. And I would dim the lights for it, but I can't. So look past me. Cranial nerve 3 is intact. Now I'm going to test for accommodation and convergence. So look up past my finger. Now look at my finger. Now follow it. Okay. Perla is noted. So next I'm going to assess for cranial nerves 3, 4, and 6, the oculomotor, trochlear, and the abducens. So we're going to follow all 6 cardinal motions. Okay. Cranial nerves 3, 4, and 6 are intact. So now I'm going to assess for the red reflex and other internal structures. So, and I would dim the lights for this too to be able to see better, but I can't with this. Alright. Optic disc, red reflex, and macula are present. So I'm going to inspect the nose. Looking at symmetric, midline, it looks normal. I'm going to check the cranial nerve 1, olfactory. Need you to smell this. What does it smell like?
Okay.
Alright. Cranial nerve 1 is intact. Now I'm going to assess nasal patency. Blow in and out both sides, each side. Cover the other side. Okay. The nasal passages are patent. Now I'm going to palpate the frontal and maxillary sinuses. Okay. Now I'm going to look at the throat and the mouth. I'm checking the lips, the teeth, the gums, buccal mucosa. We'll be looking at the palate, the tongue, top and under, which is the floor. The salivary ducts, posterior pharynx, and the tonsils. The buccal mucosa is pink and moist, and then the tonsils are grade 1. Now I'm going to assess 9 and 10. The glossopharyngeal and the I need you to write the eye. Alright. So the uvula does rise and fall. So 9 and 10 are intact. We'll do 10 and the hypoglossal. I'm gonna do the hypoglossal. Stick your tongue out and move it around. Okay, it is intact. Now I'm gonna be palpating the trachea and assess the neck. It is midline. Now I need you to swallow. Someone assess the thyroid. Now I'm going to palpate the thyroid, the carotid arteries, both sides. Okay, those are fine. Now I'm going to be less than 4 bruise in the carotid with the bell. No bruise noted. Now if you can turn around on the thing. So I'm assessing for signs and symptoms of respiratory distress. Accessory muscle use, the tripod position, any tachypnea, if there's retractions, cyanosis, nothing's noted. I'm checking for deformities and some symmetry. Take a deep breath. Okay, it is symmetric, rise and fall. Expansion was normal. I'm gonna check for tactile fremitus, say 99. Okay. I'm going to percuss over the lung field. All 10. Alright. So there's resonance throughout bilateral. Now I'm going to auscultate all 10. Lung sounds are clear bilaterally. They were equal. Now I'm going to auscultate for egophony. Say E-E.
E-E. E-E. E-E. E-E. E-E. E-E. E-E. E-E.
Now I'm gonna do broad confidence. Say 99.
99, 99, 99, 99, 99, 99, 99.
Now, whisper pectoriliquy. So 1, 2, 3. Whisper. Alright, now I need you to turn around for me. Now I'm looking on the anterior chest for any deformities or any issues. No deformities. Palpate the chest for expansion. Okay, that's normal. And it's equal. Now I'm going to do the tactile front test on the front. So 99.
99, 99, 99, 99, 99, 99.
Okay. I'm also going to take lung sounds on the front. Lung sounds are clear and equal bilaterally. I'm also going to take the heart sounds. I'll find sounds with the bell and the diaphragm, the aortic, pulmonic, Herb's point, tricuspid, mitral. I'll flip it over to the diaphragm, aortic, pulmonic, Herb's point, tricuspid, and mitral. Alright. Now I'm going to palpate for PMI. Okay. Now I'm going to listen over the apical pulse. I'm going to listen over the mitral. And I would count for 60 seconds. Listen for 60. We're going to say it's normal. Regular S1 and S2 were heard, and the rate's 75. I'm going to have them lay down. And it should be 30, 45 degrees. I'm assessing for JVD. Okay, turn your head that way. Alright, this way. Okay, none noted. Now, I'm inspecting the chest. Looking for heaves or lifts. None are noted. I'm going to palpate over the 5 points, the aortic, pulmonic, Herb's point, tricuspid, mitral. No thrills are noted. Now I'm going to listen hard again with both bell and diaphragm. Aortic, pulmonic, Herb's point, tricuspid, mitral. Aortic, pulmonic, Herb's point, tricuspid, and mitral. Okay. So now I'm going to inspect the abdomen. I'm looking at it's flat, symmetric. I'm going to also take for bruise over the aorta, the iliac arteries, the femoral arteries, and I'm also take for bowel sounds. All 4 quadrants, bowel sounds are normal active. Now I'm going to percuss in all 4 quadrants. Dullness is noted over the organs, tympany throughout the rest. Now I'm going to palpate for any tenderness or masses. Okay, no masses noted. Now I'm going to palpate over the liver now. Hold your breath. No, can't feel it. And the spleen, can't feel it. Okay, now if you can sit up and face that way. I'm percussing for CA tenderness. Any pain here?
No.
Okay. Alright, can you turn back around now? Now we're going to assess the musculoskeletal. Now I'm going to be inspecting and palpating the hands, joints of the hands, wrists, shoulders, elbows and shoulders. I'm looking for any crepitus, redness, edema. They are symmetric. So I'm going to check Capri feel, less than 3. Radial pulses, bilateral, they're +2. We're going to do range of motion of the fingers. So flexion, out, extension, hyperextension, abduction, adduction, thumb opposition. Good. Now we're going to do your wrist. So flexion, extension, hyperextension. Good. The ulnar deviation, radial deviation, rotation. Good. Now I'm going to assess the range of motion of the elbows. So we're going to flexion, extension, and then hyperextension. Good. Alright, shoulders. So I'm going to flexion, extension, hyperextension, internal rotation goes behind the back. Yep. And then external rotation. Good. Alright. Now abduction, adduction, and circumduction. Okay. Now we're going to assess the strengths of the hands, grips. Okay. 5 out of 5 bilateral. Now I'm going to assess strength of the biceps, triceps pull up against me. Push down. There, 5 out of 5 bilateral. What is this? The shoulder girdle. Make a T. Alright. Alright, push down. Okay, there, 5 out of 5 too. Now what's this? Cranial nerve 11, the spinal accessory, so shrug against me. Okay, cranial nerve 11 is intact. Now we are going to assess the cerebellar coordination with the rapid alternating movements. So the serial finger opposition, good. All right, hand flip flop. Okay, and now I need you to touch your nose, touch my finger. No, one at a time. Yeah. All right. Good. Okay. So I'm going to be doing stereognosis. So, what object is this in your hand? Don't look.
Rower.
All right. What about that one? Okay.
That's 2.
Now we're going to do graphesthesia. So you got to tell me what number I'm drawing.
7.
Okay.
6.
Okay. Good job. I'll be checking the overall warmth, color, the skin integrity of the lower extremities. Upper extremities, everything looks intact and dry. They're all warm. We're going to do light touch sensation. Close your eyes. Tell me where I'm touching.
Bicep. Lower leg.
Okay. Now we're going to do vibratory sensation. All in there. Okay. I'm going to do a deep tendon, the brachioradialis. And breaking. I'm doing that. Both sides. And then patellar. And then we're doing the Achilles and the Babinski. Okay. Now I'll be assessing the knees, hips, and ankles, toes, looking for any deformities or anything. They are symmetric. No deformities noted. Cap reef on the toes. Less than 3. Alright. The dorsalis pedis pulses. Plus 2 bilateral. The post-tibial. Plus 2 bilateral. Now I'm going to assess the range of motion of the toes. So flexion, extension, hyperextension. Now you're going to abduction, adduction. Good. Now we're going to do range of motion of the ankles. So dorsiflexion, foot down, both of them. Plantar flexion, foot up, inversion, turn them in, eversion out. Okay, rotation. Good job. Now we're going to assess the strengths of the ankles. Pull up. Okay, push down. Okay. 5 out of 5 on ankle strengths. So knee strength, pull up, or pull against me. Knee strengths are 5 out of 5. And we're going to do the hips. Pull out, push in. Okay. Hip strengths are 5 out of 5 bilateral. Now I need you to stand for me. We're doing range of motion of the hip. Alright, so right leg, flexion, extension, hyperextension, circumduction, abduction, adduction, internal rotation, external rotation. Okay? We're going to do the left leg. Flexion, extension, hyperextension. Okay, circumduction, abduction, adduction. Okay, internal rotation, external rotation. Okay. Now we're going to do the range of motion of the knees. Okay, so bend it, flexion, extension, hyperextension. Okay. And we're going to do the left leg, flexion, extension, hyperextension. Okay. Next, I'm going to inspect and palpate the spine. So I'm bend over here. So I'm looking for alignment. Everything appears normal. There's no scoliosis noted, no deformities. And this is actually flexion of the lumbar spine. So range of motion, this flexion. All right, stand up. This is extension. A hyperextension. Come back. Okay. Lateral flexion, side to side. Yep. All right, rotation. Turn it the hip. Yep, both sides. Good. Now we're going to do the range of motion of the cervical spine. Chin to your chest, flexion, extension, hyperextension. Now you're going to do lateral flexion, ear to your shoulders. Okay. Now look back towards me, rotation. Yep, both sides. Good. Now we're going to assess Romberg. Check and balance, so close your eyes. Normal balance. Now we're going to assess your gait. So if you'll take a few steps towards the camera, now turn around, come back heel to toe. This is tandem. Okay, those are regular. Okay, turn around. Now I'm going to have you hop on one foot. A swap feet. Perfect. All right. Well, that concludes my head to toe assessment. Thank you very much.